the virtual care technology trends that will transform healthcare. This is Healthcare IT News. Patty wrote this art. Patty Padmanabhan, who does consulting in the industry, whose stuff I like. He has a podcast as well. It's with Damo Consulting. Let's see. He wrote a handful of things. So I'm just going to pull out the 20 or 10 stories in 20 minutes. Three main points: the rise of contactless experiences. As is often happens in major catastrophic events, natural or human-made, many societal practices change irreversibly. The pandemic has made us all afraid to touch any surface exposed to the public. So there's going to be a rise of contactless experiences, his first point. Second one, contact tracing. Inspired by the success of Singapore and South Korea, contact tracing applications on Bluetooth-enabled devices have been positioned as an effective means to track and trace infections to reduce the spread of COVID-19. And his third thing is remote monitoring and automated communication. Healthcare executives are more motivated than ever to keep their populations healthy in their homes. The rise of telehealth and intelligent remote monitoring devices now allow patient populations to stay at home and manage their chronic care conditions, avoid visits to hospitals, and communicate on a real-time basis with their caregivers. Here's the so what. Absolutely yes on the contactless experience. I'm starting to experience that. I had some furniture delivered. We moved into a new house. We got a new chair, and they delivered it, and the whole experience was contactless. They took a picture in the house of the thing. I didn't have to sign anything. I didn't even have to do the finger thing on somebody's phone, which as a phone is one of the just a complete carrier of germs and viruses. I think that contactless experience is going to be a new thing in our culture. Contact tracing, I think it's going absolutely nowhere. I think it's going to be swallowed up in the political abyss. Again, not a technology problem. I think it's an adoption problem, and I think it's a politics problem. And again, not stating whether we should or should not be doing it. I'm just saying it's going to get swallowed up. We are not South Korea, and we are not Singapore. We don't have the same culture, and so I think that's going to get swallowed up. Remote monitoring and automated communication, absolutely. I think we're going to see the rise of the home as the new locus for caring for the aged. I think we're going to see people really try to stay away from going into long-term care facilities, stay at home more. I think you're going to see chronic patients start to wire up their homes with Internet of Things devices, and you're going to see a whole host of things happen around that. I think that's the thing to keep an eye on. It's really going to be interesting.